Basically, it was a broken neck.
It was different because it wasn't born of trauma. It wasn't a result of a car accident.
Dr. Nicandro was, when we met him, he'd already had a look at the case because he found it very intriguing, very interesting. The whole of the staff at the hospital were fantastic. You feel you're in confident hands, experienced hands, and he knows exactly what he's doing.
Big thank you to Dr. Nicandro and his team and all the other people who were so supportive in helping me get back to something like normal.
Thank you very much. I'm Julia Johnson, and this is my husband,
Brian Johnson.
He's an architect and I'm a children's author. We've lived in Dubai since 1975. We're both in our 70s. I'm 71, he's 73. Our journey to see Dr. Nicandro and have surgery started way back at the beginning of November, when Brian woke up one morning with a bad pain in his neck.
Yes, and it was very strange because we went through lots of different procedures and saw lots of different people, and ultimately the actual pain in the neck moved from one side to the other, and finally we ended up seeing Dr. Nicandro.
Dr. Nicandro was very interested in Brian's case. It was quite unusual. He'd seen, basically, it was a broken neck, wasn't it?
Yes, effectively, and the unusual thing about it, which I think appealed to him, was that it was different because it wasn't born of trauma. It wasn't a result of a car accident or a fall or anything. It was actually due to various decalcification and necrosis of the bones in my neck following some cancer treatment that I'd had 15 years ago.
Yeah, radiotherapy, which we'd have gone through again, obviously, but we didn't realise the implications it could have later. Dr. Nicandro was, when we met him, he'd already had a look at the case because he found it very intriguing, very interesting, and he immediately filled us with confidence.
Yes, definitely, absolutely. And very enthusiastic. I mean, he definitely fancied the challenge of fixing my neck, you know, for sure.
I said to him, do you like a challenge? And yes, he said he definitely liked a challenge. And I think that's very important in a surgeon, that you feel you're in confident hands, experienced hands, and he knows exactly what he's doing, but it's a little bit different. So it's a challenge for him. He's very focused, and he took us through the procedure, how the operation would go. And he also kept me very informed as to what was going on. We found him very informative and really filled you with confidence. Not just Dr. Nicandro, we thought the whole of the staff at the hospital were fantastic.
My name is Nicandro. I'm a spinal neurosurgeon. I work in King's College Hospital, London, in Dubai. I had the chance of seeing Mr. Brian and his family. He was referred to me by another colleague with history of severe craniocervical pain on this junction between the cervical spine and his brain. He had tongue cancer many years before, and radiotherapy as part of the treatment. He developed a rare late radionecrosis on this bone, on this craniocervical region. Because of this radionecrosis, he developed also a deformity of his craniocervical junction and significant instability on the same region, which was the reason why he came to us with severe pain and difficulty even for swallowing associated with this problem on his craniocervical area. After analyzing his case deeply, discussed with my team and with the radiologist, we found out what was the main problem, and we decided to go for the craniocervical posterior decompression and fixation of his spine. It was a very complex surgery, quite unusual, in which we performed on his prone position. We made this craniocervical approach and fixation in order to stabilize his spine and give him the opportunity to walk again and to look straight as should be. We performed his surgery. It was a very complex case in which we performed the craniocervical approach, and we making this fixation between the cranium and the cervical region, which was mandatory in order to stabilize his spine. So after surgery, he went to our ICU, where he was treated by the multidisciplinary team about his infection, radionecrosis, pain, and the postoperative care after this craniocervical fixation.
So after the surgery, he came in to see you and check on the scar, which is very faint now. In fact, it was pretty invisible straight away.
It will be invisible when my hair's grown.
Yes.
It's amazing. So as I said to Julia, you know, my head's screwed on better than yours now.
But your head is now in a fixed...
Yes, I've got limited movement, but it's still pretty good, actually.
And absolutely no pain.
No, that's the main thing. I could not recommend more highly Dr. Nicandro. I think he's an amazing surgeon. He's incredibly organized. The pictures that we've seen of the operating theatre with all his PowerPoint presentation laid out on the wall.
And the team already knowing exactly what they're doing.
No, they did a fantastic job.
And also the equipment at King's was phenomenal.
Yeah.
That O ring that they...
Yes, they've got the most amazing up-to-date equipment there as well.
We would go to King's for everything now.
So I think we'd both like to say a big thank you to Dr. Nicandro and his team and all the other people who were so supportive in helping me get back to something like normal.
Thank you very much.
Mr. Brian, he was treated for a long period in our hospital, and fortunately he had a very good recovery. He started walking a few days after surgery and no neurological deficits, completely recovered, just following up on my clinic. And he's doing fine. He's currently under my care with clinical and image follow-up, but he's doing great. No more pain, neurologically completely intact, going back to his regular activities.